120 over 80. You've probably heard these numbers at the doctor's office, on TV, or maybe even from a family member checking their blood pressure at home. You hear it all the time. But have you ever wondered what those numbers actually mean, and why they matter so much for your health? It's easy to feel confused or even a little intimidated when you see those numbers pop up on the screen, but what do those numbers really represent? Today, I'm breaking down systolic versus diastolic blood pressure. Let's make sense of these numbers simply, quickly, and with science on our side. By the end of this video, you'll know exactly what your blood pressure reading means, and why it's so important to keep it in check. Alright, so what is blood pressure anyway? Think of it as the force that keeps your blood moving through your body, delivering oxygen and nutrients to every cell. It's the force your blood uses to push against your artery walls with every heartbeat. This force is measured with two numbers, systolic over diastolic. These numbers are like a snapshot of how hard your heart is working and how relaxed it gets between beats. Sounds fancy, but stick with me. It's actually pretty easy to understand. Once you get the basics, you'll be able to interpret your own readings like a pro. Let's start with the top number, systolic pressure. This is the first number you see, and it's always listed above or before the other. This shows the pressure in your arteries at the exact moment your heart contracts and pushes blood out to the rest of your body. Basically, it's the peak force your heart needs to pump blood through your body. Imagine your heart as a powerful pump. Systolic pressure is the maximum pressure it generates with each beat. So if your blood pressure is 120/80ths, that 120 up top, that's your systolic pressure, your heart in action. It's the number that tells you how hard your heart is working when it's at its most active. Now the bottom number is diastolic pressure. This is just as important as the top number, but it's often less understood. This one measures the pressure in your arteries when your heart is resting and refilling with blood. It's the lowest pressure your arteries experience, happening in the brief pause between heartbeats when your heart is getting ready for the next pump. That 80 underneath, that's diastolic. Your heart taking a break, getting ready for the next pump. It's like the calm between the storms, giving your heart a moment to recharge. So, what's a normal reading? What should you be aiming for when you check your blood pressure? Generally, you want to see about 120 over 80 millimeters of mercury, or mmHg if you want to sound official. This is considered the gold standard for healthy adults. 120 is your systolic, when your heart is contracting. 80 is your diastolic, when it's resting. These two numbers work together to give you a complete picture of your heart's workload and recovery. Both numbers together give you the big picture of how your heart is working. If either number is out of range, it can signal different types of health risks. But when should you be concerned? It's not just about one high reading, it's about patterns over time. If your systolic creeps up to 130 or higher, or your diastolic is over 80, that could mean a higher risk for things like heart attack, stroke, or even kidney issues. High blood pressure is often called the silent killer because it usually has no symptoms until serious damage is done. If your numbers are consistently high, don't brush it off. Check in with your doctor. Early detection and management can make a huge difference in your long-term health. So, what affects these numbers? There are a lot of factors, and some might surprise you. Stress can crank them up. When you're anxious or under pressure, your body releases hormones that temporarily raise your blood pressure. So can a salty diet, lack of exercise, not enough sleep, your genetics, and even your age. As we get older, our blood vessels can become less flexible, making it harder for blood to flow smoothly. And even some medications. Certain prescriptions, over-the-counter drugs, and supplements can all have an impact on your blood pressure. So always check with your healthcare provider. Keeping track of these factors can help you stay on top of your numbers. Quick takeaway. Regular monitoring, healthy habits, and knowing your numbers are key to protecting your heart. Systolic is the pressure when your heart's working hard. Pumping. It's the go phase, when your heart is pushing blood out to your body. Diastolic is the pressure between beats. Resting. It's the rest phase, when your heart is filling up and preparing for the next beat. Together, these numbers tell a complete story about your heart's health. Understanding them empowers you to take control of your well-being and make informed choices every day. Hit like, share, and subscribe for more Health Explainers made easy. Your support helps us bring you more clear, science-backed information. And hey, drop your latest blood pressure reading in the comments. Let's keep learning together. Remember, knowledge is power when it comes to your health.